Hey everybody, this is Chris, and today we are going to be talking about hyperglycemia and hypoglycemia. I want to remind everyone that this is not a channel that is used for self-diagnosis. If you have any questions or issues with these particular processes, please consult with your primary healthcare provider or your healthcare teams. This channel is only used for educational purpose so you can better understand disease processes and the treatments. With that out of the way, what is hyperglycemia and hypoglycemia? Hyperglycemia is whenever you have an excessive amount of glucose in your blood. And hypoglycemia is going to be whenever you have a low amount of glucose in the blood. So, what are the normal ranges of blood glucose or blood sugar? Your normal fasting blood sugar is going to be, for most adults without diabetes, 70 to 99. That means that not directly after eating, fasting blood sugar, it's going to be between 70 and 99 whenever you do a blood sugar check. Pre-diabetic is going to be 100 to 125. Diabetes is going to be about 126 and higher for your diabetics. Now, a low blood sugar is going to be whenever your blood glucose is checked and is below 70, and a severely low blood sugar is going to be below 55. Whenever we're looking at severe hyperglycemia, we're looking at over 300, and a high blood sugar is going to be like over 180, 200, depending on your normal range, but generally above 180. So now that we know the difference between hyperglycemia, hypoglycemia, and these normal ranges, what are the causes? The causes generally for hypoglycemia is going to be you've taken too much insulin, diabetes medication, you've skipped a meal, you're exercising a lot, and you haven't eaten enough. Alcohol use can sometimes cause hypoglycemia and hyperglycemia. And vomiting and other illnesses can also cause your blood sugar to drop. The majority of people that are going to end up with hypoglycemia are going to be people that are diabetic. Other people can get hypoglycemic. Generally, the diabetics are the ones that are going to have the biggest problem with this, however. So what are the symptoms of having hypoglycemia? Think cold and clammy. Give me candy. So cold, you're going to feel a little shaky, a little hungry. You're going to feel a little sweaty or clammy. You're going to be anxious. You can have dizziness and headaches. If it starts getting low enough, it can cause some confusion. You'll have some irritability. It can affect your heart rate, can cause it to go up a little bit. And then if your blood sugar gets really low, it could even cause seizures, syncopal episodes, or where you pass out, and coma. So this is why this can be a very big issue. If your blood sugar gets low enough, you can actually get to a point where you can't get to food and eat. You need to address this as soon as possible. A lot of diabetics do recognize when their blood sugars get low, luckily, and are able to intervene quickly. However, whenever they're not able to, if you have a friend that's a diabetic and then all of a sudden they just aren't feeling well and then they go down, there is a high chance that they could have a hypoglycemic event and they need sugar. If they are awake and aroused, you can give them some candy, juice, soda, things like that. Think of the 15 and 15 rule, which is going to be 15 grams of fast-acting sugars, and wait 15 minutes to recheck the blood sugar. If that doesn't work, you can do this again until you get your blood sugar more regulated. However, these quick-acting sugars are not going to sustain for a long time. Once you get to a more regular spot on your blood sugar, you should consume something like proteins or longer-acting carbs that are going to help maintain a high blood sugar. But these fast-acting sugars are just it's just to get them out of this immediate danger state or spot in their blood sugar. So in severe urgencies, call 911. If they're seizing, in a coma, unarousable, or not able to stay awake, call 911. And then whenever the ambulance gets there, we can maybe get an IV started, some dextrose in their blood, and continue to monitor. And then also monitor some of their electrolytes and everything like that that can shift whenever we give some of these interventions. So that's hypoglycemia. hyperglycemia, you're going to, like I said, above 180 is kind of your low end of hyperglycemia. That's barely hyperglycemic for most diabetics, but severe hyperglycemic, 300 and above, 600 and above. This is the ones that are a little bit more dangerous. Your typical causes of this is going to be like if you're diabetic, you're not taking your insulin, you've missed your insulin dosage, if you've missed your diabetes medications, if you're eating too many carbs, if you have excessive amounts of stress where cortisol levels go high and your body is releasing more glucose. The cortisols are causing your body to release more glucose into the blood. Infections can cause that same reaction. Sometimes medications can increase the amount of blood sugar in our body, such as steroids, and other illnesses can also cause that stress that will do that. Now, medications that can also affect blood sugar is going to be steroids. Prednisone's a big one. Some of your antipsychotics can cause a little bump in your blood sugar, like clonazepam, olanzapine, chlorpromazine. Some diuretics can have a mild impact on your blood sugar. And then certain medications for transplants and autoimmune diseases can also have a mild effect to your blood sugar as well. And then, of course, like glucose tabs, but generally we're taking that only to treat low blood sugar. If you take too much, it can cause you to overshoot and go into hyperglycemia. Be careful treating that. There's a reason why you took that tablet. Let your blood sugar kind of naturally go down. If it gets up into the 300-400s, obviously, take a little bit of something. Let your blood sugar maintain. And if it's getting to where you can't manage it, you may have to consult with a doctor. So, what are some of the symptoms of hyperglycemia? It's going to be increased thirst, frequent urination, fatigue, blurry vision, dry mouth. Think of high and dry, sugar high. So that means your mouth's dry, you're feeling thirsty, you're urinating too much, you're feeling tired, you have that cotton mouth feeling. Like those are all the big symptoms of the hyperglycemia. And if it gets severe enough, it can actually cause confusion, vomiting, abdominal pain. It can cause you to breathe really fast. This is generally going to be more long-term high blood sugars. It can cause you to go into Kussmaul breathing due to the buildup of acid in your blood. And then you can also have a fruity breath odor. And that means that you have ketones in your blood. Generally, I hear that this kind of is like whenever somebody's been drinking and it smells like somebody has like that alcohol smell on their breath. That's kind of that fruity breath smell that we're talking about. And you can also be severely dehydrated. So if we get to this stage, this is also in a medical emergency. It needs to be treated in the ER. We have to watch blood sugars very carefully. We have to watch electrolytes and fluids very carefully. There's a lot of monitoring that goes in there. It can cause big issues if this isn't watched. If we bring down electrolytes too low, what can happen is we can, like potassium is one of the big ones that we watch for. If we bring that level too low, the heart will stop functioning appropriately, and it can actually result in cardiac arrest or death. So this is why getting to the emergency department is very important in some of these situations, because this isn't something that you can just manage at home. This requires frequent lab checks to see what our electrolytes are doing. It requires us to see what our overall dehydration status is, while also continuously monitoring the blood sugar in the process, and also looking at some of these ketones, kidney functions. There's a lot of things that can be affected through all of this. So, treatments. Insulin is going to be your number one treatment for hyperglycemia. If it gets to that point, electrolyte replacement, IV fluids, ICU care even. Like you could very easily end up into the ICU, especially if you get into HHS or DKA. So that's kind of the very quick rundown of hyperglycemia and hypoglycemia. I didn't cover this very well in the diabetic video because it just would have added way too much time to the video. I wanted to release this very soon after diabetic video because the diabetes mostly just focused on what causes diabetes, the etiology behind diabetes and stuff like that. I didn't cover very well some of the other complications with diabetes, such as hyper and hypoglycemia. So I felt very necessary to get this out sooner than later. Hopefully everybody was able to get something out of this video. If I missed something, I'm sorry. If there's something you like about this video, let me know what it is. If there's something you don't like about this video, let me know. I want to try to make these videos as good as possible, so that way you can understand it. I want to cater it to you, the audience, so that it is easy to understand and follow. Anyways, y'all have a wonderful day or night, depending on where you're watching at in the world. And until next time, I say goodbye.